Hi everyone, we're from Lee Health Asthma and COPD Management Department. My name is Robert Seifrit and I'm one of the Asthma and COPD Education Specialists. This is Teresa Summe. She's the manager of the Asthma and COPD Management Department here at Lee Health. And today we wanted to talk to you about asthma. There's approximately 24 million individuals in the United States that have asthma, and that's according to the Centers for Disease Control and Prevention and the National Heart, Lung, and Blood Institutes of Health. So a lot of people are affected by this disease. So we also have to ask ourselves a question, well, if so many people are affected by it, what is asthma? So it's really a chronic swelling inside your airways, and we're going to show you that with a model that we have here, and Teresa's going to explain that to us.
Okay. Let's start with, there's your normal airways. You can see it's nice and opened up. Lots of room for someone to breathe, whether it's a child or an adult. And then show the muscle rep.
Okay. Go ahead.
Do you see these little brown stripes all around the airways? Those are your muscle. And what happens with your muscle, he's pointing them out. They wrap within your airway. And the first thing that happens with any asthma symptoms or during an asthma attack, it just squeezes down and tightens down on the airways he's demonstrating. The second thing that happens is you get swelling in your airways, and the airways just swell inside. And then the third, the secretions, as he's showing you. So as you can see with this model, by the time you get the constricting of the airways, the swelling within, and the secretions, it's pretty hard to breathe. And when we talk about asthma symptoms, Rob's going to go ahead and explain what we're referring to.
Right. So any asthma symptoms would be cough, you have a wheeze, you have some shortness of breath going on. You also have a lot of that tightness, the chest tightness, in addition to shortness of breath. And then a term that everyone may or may not be familiar with is retractions. That's when someone uses their extra breathing muscles or their chest to breathe up here, and even their neck muscles. So it's really important to know what asthma symptoms are. So we're ask Teresa to talk about triggers for asthma at this time.
Yeah, it's really important that you understand that you actually have a lot of influence in your environment, and your environment is instrumental in controlling your triggers, and your triggers obviously can cause symptoms. So we want to talk about some of the triggers that are outside, which obviously that's harder to control. Some of the things outside that can trigger your asthma and cause symptoms are grass, trees, flowers, dust, weather changes, pollution. So we're also going to talk about inside triggers, and this is where you can control your environment more and hopefully keep your breathing a little more under control during these unprecedented times. And some of the things are perfumes, colognes, powder, plug-in air fresheners, candles, strong cleaning products, the smell good things we use even when we're doing laundry, cockroaches, dust mites. And when I'm talking about dust mites, I'm not talking about dust that you see in the air. I'm simply referring to their microscopic little bugs, and they live in drapes and in your bedding and your pillows. And most of these things that really irritate your asthma, they survive in dark and humidity and heat. So as you can imagine, in Florida, a lot of things are growing, no matter how much you work to keep things, clean in your home. So I want to give you some tips here in your home to keep it as asthma friendly as possible, especially during these times. I want you to not use any plug-in air fresheners, do not burn candles, try to avoid perfumes, colognes, keep your air conditioner on. It's really important that your windows are closed, your doors are closed, so the outside triggers stay outside. The inside, you want to keep your humidity as best you can, less than 50%. Keep food in sealed containers, counters cleaned off. That'll help eliminate the bug problem. Remember to wash your bedding in as hot a water as possible once a week. That'll help reduce the dust mites. There's also HEPA filter vacuums, and you don't have to buy anything expensive, and you can use those at home to keep the floors clean. Clean your air conditioner filter, and I think Rob will vouch for this. It's so important that that filter is changed monthly. Some filters you can also clean and wash monthly, so either one is fine. And it's really important, very important tip, that someone who has asthma has one room in their home that's considered an asthma-friendly environment, and that is usually the
bedroom.
Absolutely. So with that, you want to keep it clean, dust-free, and follow all the advice we just gave you. If you have any symptoms, you'll want to immediately follow your asthma action plan.
Absolutely.
Do you want to show, Rob will show you here one that just for many of our patients here at Lee Health. An action plan simply will tell you it's got a red, yellow, and a green zone. You always want to be in the green zone, so you want to do what you can. That just means that you're doing really well. Yellow zone means you have any asthma symptoms at all and you treat immediately. And red means you're having trouble and you're going to need to go to the doctor. You want to call your doctor and then go to the emergency department right away or call 911.
Absolutely.
So first thing you want to do is any asthma symptoms at all, you'll want to take your rescue medicine. And that is a form of albuterol, whether it's an inhaler or nebulizer. That starts working immediately, but it also takes about 15 minutes full effect. Some physicians, your doctors or providers, will tell you if your symptoms don't clear up in 15 minutes that you can take another rescue medicine. Again, that's up to your provider. Always follow your doctor recommendations and do what they've prescribed for you to do. You also want to make sure you take your controller medicines every day. Controller medicines, if you'll show them again, Rob, the swelling in your airway. He's going to show you on that little lung model. That swelling that's in your airway, controller medicines are designed to take once or twice a day, and they get rid of the swelling so it's back to normal. So that when you do have any trouble and the airways tighten and constrict, then your rescue medicines are going to work. More effectively.
Little humor to the video,
yeah,
everyone.
Sorry about that. Anyway, I just want you to know that we're here for you, and try to avoid as much stress as you can. I know that's difficult at this time. Try to get away, try to relax. Remember, stress can also be an asthma trigger.
Yeah, and also please always remember that we at Lee Health care a lot about you and your needs, and we just want you to know that we are here in case you need us, and we wanted to thank you for this opportunity to share this information with you.
Super. Thank you so much.
And stay safe, everyone.